What's up, guys? Cole here, H-Mob Fitness. So today we're gonna do um, two two separate mobilizations for our leg. Okay, so first one we're gonna go after kind of our hamstring, and it's a PNF technique. That's something where you have a contraction with a stretch. So you do a slight contraction of the muscle and then you put it into a stretch. So it's more of a neurological lengthening per se, opposed to physiological lengthening of the muscle. So this will really help with any knee pain. We're gonna really give slack into those hamstrings. A lot of the issue is they'll always be in some sort of slight knee flexion, and when you do that, when you kind of have a little hinge on your knee, those quads and structures around the knee are always kind of put under tension. So if we can so the reason why for that is, well, your quads can be tight, but also your hamstrings, if they are tighter, or not really cleaned up with all the tissue and stuff, they can be put under tension because the hamstrings are a knee flexor. So it can be both little quads and hamstrings, but for now we're going to go after the hamstring aspect of that. And also that'll help loosen up the calf a little bit, because the calf is a knee extender as well as a plantar flexor, and so they're kind of antagonists of each other. So if we loosen up that, that'll actually help with our calf stiffness a bit. And the next thing will be a hip flexion. Okay, so hip flexion, big issue with society. We're always sitting, our hip, we're always pretty much in a 90-degree angle. That thing is just always tight, and if that is tight, we're not going to have the ability to get into hip extension, okay, via our glutes. That's why people's glutes are weak, because we're always in this flex position. We're getting that muscle, the psoas iliacus, really tight, but the maximus, medius, a lot of those muscles, even the hip rotators, piriformis, are not getting adequate amount, because they're just sitting, and then when we go out and do something, they don't get turned on enough because they're shut off. Okay, so these two movements, they're important for really increasing your quality of life and trying to get all of those a lot of those bad movements. We're always in flexion and then a little bit of knee flexion too. So this is what you're gonna do. Have a band. Okay, this is a green, forget the company, body bands. Okay, so this is like 75 to 150 pounds of pressure. More pressure the better, I think. Okay, and you're gonna get in the band all the way. Okay, so you see that? It's all the way top of my head. Okay, you're gonna walk out. Maybe I'll just kind of get an angle here so you can see that a little bit. You're gonna walk out. So here's the band all the way in my hip crease, and you're gonna put this leg out a little bit, your other leg back. Okay, and there's no real science to that. You're just trying to get a steady base. So you want your knee and some flexion. Okay, and from here you're just gonna hinge over at the hip, and then try and put that knee, the one with the band on it, into extension. Okay, so you're in flexion, you go extension. Try not to move your base foot or anything. You're just trying to have a steady platform and just push it into knee extension. Okay, and the whole point of this is you just you do it, and then you try and go down a little farther each time. Try and fold forward, fold forward. There's definitely ways you can increase the tension. You could put your foot on a slight incline so you get a little more calf in there. You can take this base leg, walk it forward a little bit more, so there's less of a base, and your hamstrings should just get a little more under tension. Okay, so this is very important, guys, and the important thing about this is once you do a rep, try and maybe go a little bit farther down at the hinging at the hips. Make sure you're braced at the abs. Okay, and so you just want to keep doing this. This is all about reps, guys. You want to do like 50 a side. This really helps get those hamstrings lengthened neurologically. Your calf definitely feel some of this posterior chain. Okay, and the band is to just put the joint capsule in your femur in a bear position. Okay, that posterior, and give that function, that femur a little bit of function, because you know, from sitting all that, we get impingement, and we just want to loosen this guy up as much as possible. Okay, so there you go for that. That's something you can do before workout, before you jump, any of that stuff. Then what you're going to do is just simply slide over, put the band on the other side of your hip facing the anchor point, and from here, this is just a kind of a typical hip flexor stretch. Okay, you're going to squeeze your butt into extension, because that's the motion we're missing a lot, and then just lean into it. Okay, and you're just going to feel it all on your front side. So there you go, guys. Those two movements, you should be pretty religious about that. Obviously, the whole myofascial release stuff, you know, getting in there, you know, with the ball, loosen up is good, but that's really important because you get that hip mobilization in there too. Okay, and these are just movements that get put under tension quite a lot. Hip flexor one, should spend at least 2 to 3 minutes in that. I just have a little awkward setup, so I couldn't be in there for too long. It kind of hurt. But the knee one too, that one's actually pretty comfortable. The hip flexor one isn't as comfortable because we're so tight there. It's super hard to just stay there for a little bit. So you gotta work your way up. Also, with the hip flexor one, you can put your leg on some sort of bench, so you get your quad an extreme flexion, you get super flexion, get all those that quad is super loose, and your rectus femoris is also a knee flexor. So we gotta loosen that up too. So there you go, guys. Just those two movements, you can do them really whenever you want. Before, after, it doesn't matter. I would recommend pre-workout, especially if you're doing any sort of jumping or anything. So there you go, guys. See ya.